If you're living with diabetes or worried about developing it, you've probably heard countless tips about diet, exercise, and medications. But what if I told you there's a simpler, science-backed way to take control of your blood sugar by focusing on just 3 essential vitamins that most people are missing? These vitamins don't just help lower blood sugar, they protect your nerves, your blood vessels, and your entire body from the damage diabetes can cause. In the next few minutes, I'm going to share exactly which vitamins these are, why they matter so much, and how you can get them naturally from everyday foods. This information could change the way you manage your diabetes forever. So let's get started. Segment 1. Why vitamins matter in diabetes. Let's start with something most people overlook. Diabetes is not just a condition of high blood sugar, it's a complex metabolic disorder that affects nearly every part of your body. At its core, diabetes interferes with how your body uses and stores energy. But here's what many people don't realize. Your ability to manage blood sugar doesn't rely on medication alone. It depends heavily on micronutrients, especially vitamins that support how your cells function. You see, vitamins aren't just optional add-ons in your diet. They act like biochemical assistants, helping your enzymes, hormones, and organs do their jobs correctly. When your body is missing key vitamins, those systems break down slowly, silently, and often without immediate symptoms. That's a huge problem for anyone with diabetes, because the body is already struggling to maintain balance. Let me give you an example. Imagine your body is a complex factory. Insulin is like a delivery truck that moves glucose sugar into your cells. Now, if certain vitamins are missing, the truck either gets stuck, runs out of gas, or doesn't even know where to go. The result, sugar builds up in the blood, damaging tissues and triggering inflammation. And over time, this can lead to complications like nerve damage, kidney disease, vision problems, and heart issues. What's even more troubling is that many people with diabetes are unknowingly deficient in essential vitamins because the condition itself increases nutrient loss. High blood sugar causes you to urinate more, and with that goes water-soluble vitamins. At the same time, oxidative stress and chronic inflammation increase your body's demand for antioxidant nutrients, which can get quickly depleted. So when we talk about managing diabetes, we have to look beyond sugar and carbs. We have to look at how we're fueling the body at the cellular level. And that's where vitamins come in, not just as supplements, but as essential tools your body needs to stabilize blood sugar, repair damage, and function properly every single day. Segment 2, Vitamin D. The silent hormone. Vitamin D is one of the most overlooked yet powerful vitamins when it comes to diabetes. And it's not just a vitamin, it actually functions as a hormone in your body. And one of its key roles is in regulating insulin, the hormone responsible for lowering blood sugar. Without enough vitamin D, your pancreas, the organ that produces insulin, doesn't function as efficiently. Even your cells become less responsive to insulin, a condition we call insulin resistance, which is at the heart of type 2 diabetes. Now here's what's surprising. Research has shown that more than 80% of people with type 2 diabetes are deficient in vitamin D. That's a huge number. One study published in Diabetes Care found that individuals with low vitamin D levels had significantly higher fasting blood sugar and A1C levels compared to those with healthy levels. And this isn't just a correlation. Other clinical trials have shown that correcting a vitamin D deficiency can improve insulin sensitivity, lower inflammation, and help regulate immune function. That's especially important because chronic inflammation plays a major role in diabetes-related complications. Vitamin D helps calm that inflammation by regulating immune cells and reducing harmful cytokines, chemical messengers that promote inflammation. It also improves how your muscles and fat cells respond to insulin, allowing glucose to enter cells more effectively, which reduces blood sugar levels. So where do you get it? The most natural source is sunlight. When UVB rays hit your skin, they trigger your body to produce vitamin D. But here's the catch. Many of us don't get enough sun. Whether it's because of where we live, how much time we spend indoors, or even how much melanin we have in our skin, vitamin D production can fall short. That's why diet becomes so important. Some of the best food sources include fatty fish like salmon, mackerel, and sardines, which are not only rich in vitamin D, but also in healthy omega-3 fats. Egg yolks, mushrooms exposed to sunlight, and fortified plant-based milks like almond or soy milk are also great additions to your diet. And in some cases, especially if your levels are low, supplementation may be necessary. For most adults, a daily dose of 1,000 to 2,000 IU is considered safe and effective, but always check with your doctor and get your vitamin D levels tested before starting any supplement. Too much vitamin D can lead to calcium buildup and other issues. The takeaway here is simple but powerful. If you're living with diabetes or at risk for it, make sure you're not missing this critical nutrient. Vitamin D supports your metabolism, your immune system, your blood vessels, and your insulin sensitivity. It's one of the simplest, most natural ways to support your body in managing blood sugar, and it could be the missing link in your health puzzle. Segment 3, Vitamin B1 Thiamine, the nerve protector. Let's talk about vitamin B1, also known as thiamine. This vitamin plays a crucial role in converting the food you eat, especially carbohydrates, into usable energy. For people with diabetes, thiamine is especially important because it helps protect your nerves and blood vessels from the damaging effects of high blood sugar. Unfortunately, many people with diabetes have a thiamine deficiency, which can contribute to serious complications. One of the most common and debilitating complications of diabetes is nerve damage or diabetic neuropathy. This can cause numbness, tingling, pain, or weakness, especially in the feet and hands. Research shows that low levels of thiamine worsen this condition because thiamine is necessary for nerve cell function and repair. Without enough thiamine, your nerves become more vulnerable to injury from excess sugar and oxidative stress. Studies have found that people with diabetes often have up to 70 to 80% lower thiamine levels compared to healthy individuals. This deficiency happens for a few reasons. High blood sugar increases the loss of thiamine through the urine, and chronic inflammation also raises your body's need for it. When thiamine levels drop, your body struggles to process glucose efficiently, which worsens blood sugar control and increases the risk of nerve and kidney damage. Good sources of thiamine include whole grains like brown rice and oats, legumes such as lentils and black beans, nuts and seeds, and lean meats like pork and beef. However, because absorption can be limited in some individuals, especially those with diabetes, supplementation may be beneficial. There's a special form of thiamine called benfotiamine that's fat-soluble and better absorbed by the body. Clinical studies have shown that benfotiamine supplementation can reduce nerve pain and improve nerve function in people with diabetic neuropathy. It also helps block harmful pathways triggered by high blood sugar that lead to tissue damage. Incorporating thiamine-rich foods and considering benfotiamine supplements under medical supervision can be a powerful strategy to protect your nerves and improve overall blood sugar metabolism. This vitamin truly acts like a shield, guarding your nervous system and supporting your energy production in the battle against diabetes complications. Segment 4, Vitamin E, the cellular bodyguard. Now let's focus on vitamin E, a powerful antioxidant that acts like a bodyguard for your cells. In diabetes, one of the major problems is oxidative stress. This happens when harmful molecules called free radicals overwhelm your body's natural defenses. These free radicals damage cells, including those in your blood vessels and organs, making it harder for your body to manage blood sugar properly. Vitamin E helps neutralize these free radicals, protecting your cells from damage and reducing inflammation. This is critical because high blood sugar leads to the formation of harmful compounds known as advanced glycation end products, or AGs. These AGs accelerate the aging and stiffening of your blood vessels, worsen insulin resistance, and increase the risk of complications like heart disease and kidney problems. Clinical studies have shown that vitamin E supplementation can improve blood vessel function and insulin sensitivity in people with diabetes. It also helps reduce markers of oxidative stress, supporting healthier metabolism. What's important to understand is that vitamin E doesn't just support blood sugar levels, it helps maintain the overall health of your vascular system, which is vital since diabetes greatly increases the risk of cardiovascular disease. To get enough vitamin E naturally, focus on foods like sunflower seeds, almonds, avocados, spinach, and olive oil. These foods provide a rich source of this nutrient along with other healthy fats that support your heart and brain health. However, it's important to avoid taking excessively high doses of vitamin E supplements, as very large amounts may interfere with blood clotting and increase the risk of bleeding, especially if you're taking blood-thinning medications. Aim for about 15 milligrams a day, primarily through food. This balanced approach ensures you reap the antioxidant benefits of vitamin E without any risks. By including this vitamin in your diet, you're giving your cells the protection they need to function optimally and helping your body better manage blood sugar and inflammation, two key factors in diabetes care. Segment 5, the power of food over pills. Let me emphasize one of the most important points. Vitamins are most effective when they come from whole, real foods rather than just pills. Your body has evolved to absorb nutrients within the complex matrix of natural foods, where vitamins are paired with fiber, antioxidants, and other cofactors that work synergistically to boost their benefits. Simply popping a supplement can never fully replicate this intricate balance. When you eat a diet rich in colorful vegetables, fruits, nuts, seeds, whole grains, and lean proteins, you're providing your body with a broad spectrum of vitamins, minerals, and phytonutrients that work together to regulate blood sugar and reduce inflammation. For example, the vitamin E in almonds comes along with healthy fats that improve absorption, while the vitamin D in salmon is accompanied by omega-3 fatty acids that support heart and brain health. Moreover, relying solely on supplements can sometimes lead to imbalances or even toxicities, especially if taken in excessive amounts without medical guidance. Whole foods, on the other hand, naturally limit intake to safe levels, while delivering additional nutrients that supplements often miss. So instead of focusing only on pills, think of your meals as your first line of defense in managing diabetes. Simple swaps like choosing brown rice over white, adding spinach and nuts to your salad, or including fatty fish a couple of times a week can dramatically increase your vitamin intake and support your body's natural ability to control blood sugar. In essence, vitamins are powerful, but their true strength comes from the foods they live in. Prioritize nourishing your body with whole, nutrient-dense foods every day and use supplements wisely as a backup when needed. This holistic approach is what leads to lasting health and real progress in managing diabetes. Thank you for joining me today to explore the top 3 essential vitamins every person with diabetes needs. Remember, managing diabetes isn't just about controlling blood sugar numbers, it's about nourishing your body at the deepest level, supporting your cells, nerves, and organs with the nutrients they need to thrive. By making sure you get enough vitamin D, vitamin B1, and vitamin E, preferably through whole, nutrient-rich foods, you're giving yourself a powerful advantage in this fight. Small, consistent steps add up to big changes over time. If you found this video helpful, please share it with someone who might benefit. Don't forget to like, subscribe, and click the notification bell so you never miss evidence-based tips to help you eat to beat disease. Your health is worth it.